Ellie, and I'm here on behalf of the marketing team at School Health. I'd like to thank you for joining us today and participating in Empowering Student Success Lessons from Trenton Public Schools. Joining us today is Nurse Micah Freeman, Supervisor of Nurses and Section 504 Coordinator for students at Trenton Public School District. She will discuss the district's experience with the Spot Vision Screener, the impact on student academic success, and navigating state policies on vision screening requirements. We are also joined by School Health's Vision and Hearing Screening Specialist, Maryellen O'Keefe-Smith. Before we begin, I would like to review a few quick things about today's webinar. We will not be taking audio questions, but you can submit your questions via the Questions Interface tab in GoToWebinar. You can submit your questions anytime during the presentation. The webinar will be recorded and a link to it will be sent to all those registered after the webinar is over, along with a certificate of attendance for joining us. If you are having technical difficulties with the audio or visual portion of today's webinar, please call GoToWebinar directly at 855-352-9003. On today's topic agenda, we will learn about why instrument-based screening is a game changer, how vision impacts learning and well-being, Trenton Public Schools success story and their tips for building a winning screening program, and navigating state-level vision screening guidelines. And now I would like to turn the time over to Nurse Micah and Maryellen.
Hello, everyone, and thank you for having me. Again, my name is Micah Freeman, and I'm the Supervisor of Nurses for Trenton Public Schools. I'm so excited to be here and share our story with the Vision Screener. Next slide. So Trenton, New Jersey, we have 16,000 students from kindergarten to 12th grade. We have 25 school buildings with 29 school nurses. We have school nurses assigned to every building, which we're very fortunate of. We have elementary, intermediate, middle, and high school. Next slide. So with managing our program, we have, as you know, vision is a requirement. For the state of New Jersey, requires public schools to conduct vision screenings for students in grades kindergarten, 2nd grade, 4th grade, 6th grade, 8th grade, and 10th grade. So that is a lot of students who needs to be screened. And our goal is to make sure not only vision, but other school mandated screenings are done. In the past, we coordinated with a lovely group, Vision to Learn program, and they're throughout the state of New Jersey, where they are a 501(c), where they focus is providing vision screenings and or glasses if a student needs it. So we were able to connect with them, and they brought this strange instrument, this Spot Vision Screener. It was phenomenal. It helped our students fast, quick, and efficient, where they came in and they helped the nurses screen the students. But unfortunately, in 2023, 24, we used them, and then 25, 26 school year, their funding got cut. However, we wanted to continue with using that device, so we were able to find and use resources from the Elementary and Secondary School Emergency Relief Fund, which is called ESSER 2, which is a financial government assistance. So we were able to purchase Spot Vision Screeners. Next slide. So the value of this machine, it provides reliable service to students with reliable and accurate screening results. It empowered our school nurses to provide efficient vision and screening for students of all ages. It made completing vision screenings faster and more efficient than the traditional wall or Snellen chart. Next slide. Why the Welch Allyn Spot Vision Screener? Again, our nurses, when the Vision to Learn program, they were observed using that device. Our nurses were impressed how quickly students would be screened, how easy it was to utilize the device, and it helped meet the district's goal into providing timely and efficient vision screeners. So the purchase, and this is, you know, my goal is to make sure our nurses are supported in their workload. Is purchasing the spot vision screeners was an investment in our nursing staff. We knew it would make their jobs easier to complete. Next slide. How the spot vision screener works, well, it's phenomenal. If you look on the screen, you can see where the picture of the face of the screener. It captures the image from a non-invasive 3-foot stance. It captivating lights and sounds that help students. Students think they're really taking a picture. The spot vision screener has a 97% capture rate and quickly captures an image of both eyes in just seconds. Again, if you look at that picture, you can see the student eyes. And the amazing part of it is that it has clear results are displayed on the screen to learn if the complete eye exam is recommended. I don't know if you can see on here, but this student needed to be referred, and it says referred to a referral needed. Next slide. Again, purchasing this device, we were able to secure funds for it. And how we implement it is that we bought 4. We were able to purchase 4. We have 4 wards, east, north, south, west, and the devices are shared amongst the nurses. So there is some coordination where nurses sign out the vision screener, and they use it for about a 2 to 3 week period, and then they are switch off or, you know, sign them out as needed. Next slide. Even though the machine is very easy to use, I still want to make sure that professional development was organized for the initial training, because like with anything, you don't know how it may be scary, it may be nervous, like how do I use this machine? We did have representatives from school health who came on site and provided hands-on training with the nursing staff. The nurses actually screened each other. We all screened each other. Nurses, we wanted to make sure that they really were comfortable, confident while using the device. Then school health came back. We had a refresher training, again, to just dive in to make sure that everyone was comfortable with using the device. And now that our nurses for this upcoming school year, nurses are trained within themselves to make sure that that our new staff is comfortable using the device. Next slide. So as you know, you have to work with each other, right? So the nurses and teachers, they are a team. When the nursing staff and teachers have observed a student who may need a vision screening, it helps improve the student vision. It's easy to screen those students, and once they receive follow-up care, it does help with reading capabilities, some behavioral issues. And as you know, sometimes we would like to rule out any health issues, so it's easy to screen a student on the spot. We consider these strategic purchases that allow us to meet state mandates, but more importantly, help student overall academic success of our students, as vision loss is often tied to literacy and behavioral issues in the classroom. So this is a great tool for an easy screening. Next slide. So I wanted feedback from our school nurses, and these are actual feedback from our school nurses. What are the benefits of the spot vision screener? One nurse says the device helps when screening students with special needs that are available to perform the basic vision screening. So screening special needs students is very helpful. Another nurse said vision screening can be time consuming, and as you know, especially with language barriers or students with developmental delays. Another nurse said the spot vision screener makes it so much easier to screen an entire class. It usually takes about 20 to 30 minutes to do about five students, where they can do an entire class in about 20 to 35 students in a class. And the constant theme is speed and efficiency. Next slide. So a few other nurses, they commented, they said that the one nurse had students of about 500. It ensures all students receive his or her vision screening. The screener also picks up on things that the Snellen chart doesn't. And this particular nurse, she screens her whole school. Generally, it takes generally it makes screening more efficient, effective, and comprehensive. Another nurse says it's portable, which it is. You can carry it around, easy to use, and it's just fast with results. Another nurse said it's very beneficial for students that are unable to articulate, and especially for the younger population. And again, the common theme is speed and efficiency. Next slide. So I asked the nurses, what strategies have you used to implement your screenings? And these are some of their feedback when, in particular, the vision screening, what strategies that they implemented. The one nurse was in a special needs class, so there's not a lot of kids in the class. She said she screened the students in their classroom. Another nurse said that she works with the PE teacher, physical ed teacher, in their gym time, where the teacher will send 4 to 5 kids to her office. She screens them, they go back, and then another set of students come. She says she's in her office she used a dim area, not a well lit area, but a dim area. Then there was another nurse who said when she's preparing the environment, she works with the teacher, and this is for, I believe this was the kindergarten nurse. She said that she would, the teacher would put their names on their, like name stickies on them so that it could be more organized and minimize distractions. Then another nurse says for her younger students, the teacher identifies the students with their name, and and she makes sure that the lights are dim. And then another nurse said that her key strategies use a dimming lights, stand at a correct distance, which about 3 feet, and having students face away from the light sources to minimize glare. There is techniques that you have to use because glare could off the results. Next line. So some of the positive outcomes of using this machine, well, we complete our school mandated screenings. We have a very high percentage rate of making sure that our students who need follow-up, that they are getting follow-up with their prescriptions or extended vision screening. We reduce time to complete required screenings. So again, it takes about 5 to 8 seconds per person, per child. And a lot of times it's usually just lining up the vision screener with their eyes. The other positive result is on-demand screening for students identified by the teacher or the nurse with potential vision issues. This is absolute. We have, and I know nurses are seeing more students with developmental delays or cognitive delays. And even if you're not in New Jersey, if you're not in that class, that second grade or fourth grade, you have a third grader. They can screen a student on demand. It's not, you know, I need to set up a schedule. I need to, because it's just that quick of getting a eye exam, a screening, I'm sorry, eye screening, and a follow-up if needed. And then another positive outcome, you know, again, complete screenings with unique student population, you know, student with special needs. As you know, medical technology is getting better. We're having more students in schools that need assistance. And with this vision screener, you really don't need cooperation. You just need the kid's eyes. English as a second language and attention issues are the positive outcomes of getting the vision screener. Next line. Some lessons that we've learned in our district is that this instrument-based screening offers an efficient workflow for our vision screening. Nurses have time to focus on other tasks because of the workflow. Screenings take seconds. I want to say that again. Screenings take seconds to complete, and results are immediately available on the screen to expedite follow-up. Another thing we've learned is no cooperation is needed from the student, which makes the spot vision screener appropriate for students with attention issues, or if language is an issue. So investing in these devices mean our nursing staff have access to adequate, reliable screeners at any time for students identifying with having a problem. Next slide. Now I'm going to turn this over to Maryellen.
Thanks, Micah. Thank you for all your input on the instruments and the spot vision screener. So I'm going to do an overview on trying to navigate, excuse me, state mandated vision screening requirements. Next slide. So why states mandate screenings is for the following: early detection of amblyopia or errors, or refractive errors. You know, it's a crucial part of vision disorders. And can hinder a child in their development. So that's a real key reason for these mandated screenings. Accessibility, children who are nonverbal, having developmental delays. Micah just explained how the spot vision screener really helped with being able to complete those screenings and getting around those children that sometimes have issues understanding how to do their screenings. Accuracy, they want to make sure that the screenings are accurate and they identify any risk factors. Again, education and development. This ensures that children have equal opportunity to succeed in school. So with proper vision exam, they can then move forward and understand a little bit better on how to learn. So it improves their academic performance. I mean, it's been known that vision problems can really impact a child, and it can lead to, you know, reading issues, performance of standardized testing, socialization. So vision screening really is an important part of what is mandated by the states. Next slide, please. So how do you navigate these screening guidelines? Well, it's important to understand what the requirements are for your state. So each state has its own, you know, mandated rules on grade levels and types of vision screening equipment that can be used. Micah went through what New Jersey's is. A little later, I'm going to show you some examples of what some of the other states are being allowed to do. It also is important to align with evidence-based practices. One thing that's nice about the Spot Vision Screener is that it is an evidence-based tool that can be used. And it follows the standardized procedures. So you want to be able to do that as well. Training and certification of screening. Micah mentioned that when they purchased their devices, that they were trained specifically on how to use them. You want to make sure your staff understands how to conduct a vision screening with the device. You also want to make sure that they get refreshers, which was really nice, something that was done with Micah's team. And then implementing strong follow-up system. So again, you want to track your referrals. You want to confirm that students receive their eye exams. One of the nice things about this instrument is that it provides a database. And you not only get a really nice printout of the actual results that you can send home with the parent or guardian. You can get an approval that way. It really helps to promote those referrals and to get those eye exams. You also get a complete spreadsheet of all the eye exams that you did. The device collects all of that information, and then it does put that into a nice little Excel spreadsheet that you can transfer into your own systems that you have. Next slide. So vision screening requirements are different every state, right? There's no standardized really way of doing a vision screening. 40 states and the District of Columbia require school-age vision screening, but all the frequencies and the grade levels, everything like that varies from state to state. So reading through those requirements is important so that you understand how to conduct your screening. And then preschool screenings is about half of that. So again, that is also part of what is mandated or required or set forth in your guidelines. Head Starts require evidence-based vision screening for all children within 45 days of enrollment. That's really important. It helps give them that boost that they need as they go into the school age of learning. So those the Spot Vision Screener or instruments like that, they are evidence-based. Again, these are tools that are outlined in a lot of the state guidelines. And then the American Academy of Pediatrics recommends instrument-based screening starting at 12 months and then annually until visual acuity can be tested directly or I guess accurately, because that visual acuity does need a response from that child. So the instrument then really does help with that. The American Academy of Pediatrics recommends starting at 12 months because of the fact that children's eyes are really developing during that time frame. Now, the Spot Vision Screener, the instrument that Micah was talking about, is FDA approved for starting at 6 months and then onward through that. But it all depends on if you can really capture that child or get them when they're that young. Next slide. So what's some good compliance, your best practices? Here's a little checklist for you as you look at your state guidelines. Policies and permissions, you should have a written vision screening policy that aligns with your state requirements. And obtaining that parental consent, is really important to have as part of it. A screening schedule, see what's required, what grade levels. Often, and in a lot of states, it's, pre-K and then kindergarten, 1, 2, 3, 5, 7, and 9. And it might vary from state to state. Again, every state has their requirements set up a little differently. You want to include, the students that the teachers are flagging. One of the things Micah mentioned is that how easily it was for her to interact with the teachers and be able to, get the students screened, see if they are having a vision problem, and then get them the help that they need within that classroom to be able to learn and participate better in their classroom work. You want your personnel to be qualified, so training with these evidence-based methods is really important. Again, that's training that was something done with the purchase of the product. And then you always want to make sure it's an approved piece of equipment within that state. Next slide, please. So just moving on with some more best practices that you can, be a part of your checklist would be, the environment and the equipment. Proper lighting and quiet space. A lot of you might be doing your hearing and vision at the same time. So hearing does require a quiet space. It's nice to set that up together because then you do have that quiet area for the children to be able to be screened. The lighting, I know that in some of the nurses mentioned dimming the lights. For the spot vision screener, I know that you don't necessarily always have to dim the lights, but what you really have to look for is ambient light. So lighting from an outside source, like a window, that can really deter you and be able to get the capture. So watching for that, that's what Micah mentioned, is creating the glare that you might see. So there are techniques in how to do that, and that would be part of the training that would be set up for you. And then the documentation and follow-up. So as I mentioned earlier, there's that nice database. It records all the results accurately and securely for you so that then you can use that and transfer it into, your own personal database or filing system for how you create and keep your screenings. A lot of the states mandate that you report how many screenings you do. So you've got that built in with these instruments. And then your referrals, who fails, who got their comprehensive eye exam. That probably tracking that follow-up can be one of the more difficult things to do, but it is in some states now being more and more required for you to have to do that. So that database can also help you with, presenting you with a list and being able to check off whether or not those students received what they needed to receive. And then always evaluate your program. I mean, it's a good practice for you to go back through your program year to year, make sure that you're meeting all of those requirements or recommendations within those guidelines, seeing if there's a way for you to improve upon those, your screening and what you're doing. This also is something that we can give you help with as you work through your state guidelines. Next slide, please. So just to give you an idea of some of the people that are really embracing the instrument-based screening, whether it's allowed or if it's not specified, these are some of the states that are really a little bit more progressive in instrument-based screenings or using the spot vision screener. So California, just this past year, I believe it was last year, they put into effect that a pupil's vision may be appraised by using an eye chart or any other scientifically validated photo screening test. A lot of times instrument-based screening devices are called photo screening. So that would be also what the spot vision screener might be known as, a photo screening. Texas, they have had this ruling for several years now where instrument-based screening devices such as a photo screener can be used in accordance with the evidence-based practices and based on age and purpose. So a lot of the states have specific age recommendations for instrument-based screening and when it can be used. In Texas, they do allow it above the age of 6 because a lot of times it's state required that it be below that age, and they will allow you to use that. But you also need to put them on a wall chart or an eye chart of some sort. So you're doing both the eye chart and the instrument. Massachusetts, they allow the instrument-based screening for children 3, 4, and 5 years, which is pretty standard screening for around the country. Illinois they just automated their system for screening, and now they allow children under the age of 3, and for older children who can't be screened with a stereopsis or a distance test, so if they can't be screened on a chart. So more and more and more of these states are starting to embrace instrument-based screening and use that to help, not only free up time for those who are doing the screenings, but to, really be able to report on the screenings that they're doing. Washington State, too, also is another state. Schools can use instrument-based devices such as photo screeners instead of traditional charts. So Washington and California are really stepping this up and really moving into instrument-based screening. If the instrument is used and is unable to generate a result, then they have to put them on a wall chart or use an optotype tool of some sort that is required. So these are just some of the, like I said, some of the states that are really embracing in the instrument-based screening process, which would include the spot vision screener. Next slide, please. So instrument-based screenings that were allowed, we just talked about. Now here's some states that really don't specify anything. So Alabama doesn't really have any kind of state requirement. Now, that doesn't mean that within a specific school district or school, they don't have some protocols set into place, but Alabama as a whole does not have anything that they require, as well as Idaho and Montana. But Montana has taken that a little bit further. What they are saying is that they are recommended to periodically do some kind of screening. North Dakota, no state requirements, but some guidelines as to screenings are available. And then New Hampshire, they recommend a complete vision exam for all students within the first year of entry. And that would be for pre-K, K, and other grades. Sorry, I gotta post that up. And then South Carolina doesn't really have any requirements, but they really recommend a vision screening be done. And then there are other states that just say they don't really specify anything in particular with regards to instrument-based screenings. But what they do say is that, they want something under a general vision guideline. So not specified here really means that the state does not prohibit the use of an instrument, but it does not include it in its actual guidelines. There are no standard or universal guidelines out there, so this is really a place that we can help you with, if you're interested in learning more or having difficulties working on your own state guidelines or finding the correct equipment. This is something that we can help you with. Feel free to reach out for that. Next slide. So that just leads me into why school health is such a great place and a wonderful place that Micah said she made her purchase from, because we do have a strategic distribution agreement on the Welch Allyn Spot Vision Screener with the manufacturer. We are certified and licensed trainers, so not only myself can help with the training, but our team nationally out there working with our customers in every state, they can also help. We carry a robust inventory level at all times. And then we have exclusive offers because of our relationship and our strategic distribution agreement. So we offer a free 5-year Baxter service program with every spot vision screener that is purchased. And as you've heard from Micah, this is an investment, and it's nice to have that investment protected. There's also trade-in rebates for eligible vision screeners, and there's also rebates that we have, promotional rebates when you just make the purchase. So those are things we can work with you on. Next slide. So just to bring this back around, preserving vision and supporting, student success is something that we always, want to be able to do. That was the whole purpose behind being able to present this information to you about the spot vision screener and what Micah's team did over in Trenton. So this is just one example picture of one of the screeners performing the screening. And what Micah says here about, we praise our school nurses for following up the referrals to the parents to make sure the students who need vision corrections get the treatment that they need. When students come to school with their new glasses, or our nurses feel that they've really helped make a difference in their lives. And that's really what's important. Again, this takes you back to the fact that vision is a very important part of learning and socialization, academic scores, things of that nature. Vision screening really plays a key role in that development of a child within a school or within their life. Sets them up to do much better as they go through life. Next slide. So there's my information there, and we're going to open it up for some questions, I think, at this time.
We are. Thank you, Maryellen and Micah, for that information. So we have a question here for Micah. Can you, what was your referral rate after using the spot?
Hello, everyone, again. So it varies from school to school. I will say that our nurses were vigilant in getting follow-up when it came to assisting parents in getting the help that they needed. So, for example, in one school, if there's a school of 300, the nurse may have screened 150. So we got about 30% was at a referral rate. Like I said, it catches so much. It catches things that the Snellen chart or the chart on the board, the wall, do not catch. So the nurse, the feedback was, we got our glasses or we got exams. And that is the essence of this all, right? We want to make sure the follow-up is taken serious and that the students need what they need.
Micah, can you talk a little bit about maybe how the school or the school district kind of communicates the results to the parents of the students?
Sure. So when our students needs a referral or a follow-up, our nurses, they send home communications to their parents of those specific children. And they, also with that, they provide resources. Some families may not have insurance, so they provide resources for insurance. They provide resources for if they don't have a physician. They provide our local resources. So it is the traditional mail, but then we also have stepped it up with school messenger. They will contact the parent that way through school messenger.
Awesome. And then I know you might have briefly touched on it in your presentation, Micah, but can you talk a little bit again about, just reiterate the grant that you were kind of able to use to make the purchase for the spot?
Right. So it was a federal grant, which is called the ESSER grant, with elementary, secondary, supplemental grant. And basically that is, believe it or not, it was supplemental from the COVID era, and we were able to, it was a residual of that monies. So we were able to purchase those spot vision screeners, purchase for them, because we had to spend the money or we would lose it. So I wanted to make sure we were able to get something that was substantial, that would make a big difference. And so we just thought collectively with my team of nurses, what big item do we want? And that big item was, how can we help our students in a screening? And we picked vision because we saw Vision to Learn's product. And that's how we were able to identify the need. We had the money to secure it, and we purchased the equipment. But again, that was with the advice of our school nurses.
Great. Maryellen, can I use, an instrument-based screener like the SPOT, instrument-based screener data to kind of calculate visual acuity?
Yeah, no, unfortunately, you cannot use the SPOT vision screener or an instrument like that to calculate or convert to a visual acuity score. So, and visual acuity is, it's really different than what you would see with the SPOT. So visual acuity is how well someone sees at a distance, whereas the SPOT vision screener really takes a picture of the complete eye. So it's a little bit of a different thing, but you can't calculate any kind of visual acuity with it.
I'm also kind of, we've got a lot of people from a lot of different states. How can they kind of find what their vision screening guidelines are? Is there a good resource for them?
Yeah, if they don't already know or haven't already seen them, a lot of the state health departments, they would, you can check with that website. Most of them publish something on the Department of Health or Public Health site, or also maybe the Department of Education. That might be a great place to be able to look. So one of those two usually is where you can find them. Also, I mean, collectively, I collect a lot of the different state guidelines, and so you can feel free to reach out to me, and I'd be happy to help you run through any of your guidelines and help you find them.
And I just want to add that for New Jersey, we utilize both the Department of Education and the New Jersey Department of Health when we are looking to it. New Jersey Department of Education has a school health department or Office of School Health Department. So that a lot of our guidance, most of our guidance come from them. And then I will also suggest that if nurses are part of a New Jersey Nursing Association, to be a part of either their state nursing association or their national nursing association, you can get a lot of resources that way as well.
I have another question here. I think, Maryellen, this one may be for you. Do you also use a wall chart along with the screener, or do you utilize the results of the SPOT alone? And additionally, can you print each individual result? Can you print individual results with the screener? Sure.
So you can do both. In fact, there's a better rate of referral or non-referral, I should say, if you do both. The SPOT can be, I'm sorry, can you give me the second half of that again? Sorry about that.
Yes, give me 1 second, let me find it.
I can add if you need.
Sure, you go ahead, Micah.
So with our nurses, they do use both. Some will use the Snellen chart, which is the wall chart, and then some. So it's interesting, right? Because if we have students who may have glasses, sometimes the SPOT screener, there's a glare. So what the nurse would do is use the Snellen chart to get the screening, as long as they keep their glasses on. If you take the glasses off, they're going to have a failed result with the SPOT screener, so they need glasses. So a lot of times, if there's something where the SPOT screener doesn't, or the nurse want to confirm, because a lot in the beginning, nurses were like, they didn't really trust it as much, right? Because we got all old school, 20 plus years of school nursing. So we're like, I don't really know. So some were doing the Snellen, and then they would do the SPOT screener. And then as they got comfortable with the SPOT, they went on and did it. But there was some skeptics out there, I will say, that wanted to make sure the referral. So they would do the wall chart.
Yeah, the second part of the question was, can you print individual results with the screener, Maryellen?
Yes. Okay. Thank you. Yeah. Yes, you can. So the device actually lets you collect everything and then download it and print individually through a USB drive, or you can set up a printer directly with the device and then print on the fly. And as you go along, you can just, right after that screening, that results screen is shown that Micah had in her presentation, there's a button that says print on the screen. And so if you set up that printer, you can do that now. It'll set up to a network printer, or it will set up to a Bluetooth connection on a printer. And then you've got a very nice printout. On the printout, it'll give you the demographics of the child, a picture of their eyes, a picture of the results. It will also give you information about any issue that was found. So the device does find 6 different issues. It'll find, refractive errors like hyperopia, myopia, and astigmatism. And then it'll catch some amblyopic risk factors such as anisometropia or strabismus. And then also anisocoria, which is unequal pupil sizes. So all of that gets captured and placed nicely into an 8.5 by 11 sheet of PDF that you can load to your, like I said, your computer, or you can print on the fly.
And then you can screen students who wear glasses or contacts with the spot vision screener as well, correct?
Yes, you can. And as Micah was saying, it is a technique to it. There is a little technique, but you can, and you can screen through the glasses. And that's something that's done in training. We would train you a little bit on how to be able to screen with glasses. It does take a little time and practice to be able to do that, but it's very useful to be able to do it that way.
Wonderful. Maryellen, is the spot vision screener a pass-fail test?
Yes, it will give you a pass or refer. What it says actually on the screen is in range or out of range. So in range means that they are a pass, and out of range means that they are a refer. So it will also indicate right on the screen whether or not, it'll give you the measurements of what's out of range. But there's a threshold criteria that's placed into the machine. So if they're out of that threshold, which is out of range, then it's the referral. If they're within that criteria, then it's in range. So part of that criteria. So they're within that, and it's all age-based. So it's done in accordance with the age of the child.
Great. I think we are about out of time, so I will wrap it up here. Thank you so much, Micah, for joining us today. It was great to have you, and it was great to hear how Trenton Public Schools is using the spot vision screener. Maryellen, as always, thank you for your expertise. And that is all for today. Thanks so much.
Thank you.
Thank you.